Hello, hello, good day. Hello, how are you?
I'm good. How are you?
We are good here. I am Dr. Kabir.
Dr. Kabir. Hi, I'm Rana.
Can you see our patient?
Yes. Hello.
That is Usman, the small boy sitting by the side of his auntie. And
Hey.
that's his auntie is
Hi.
sitting in place of the mother who is also having a sick child. You know, it's a big family. They have a family of 10. The
Oh,
mother
wow.
has 10 children.
Okay. Well,
And this
yeah.
at this moment, two of the kids are sick, and both are on admission. Usman and this our patient Usman, and the other sibling is sick. So the auntie has to come and stay with this one, and the mother stay with the other one.
So, what's bothering you today?
Usman has fever today and headache.
Is it a constant fever or does it come and
Let
go?
me ask. Ya wai zazzabin nasa yana zuwa da wani ko kuma yana nan. So that his fever is continuous.
Have you been feeling any abdominal pain or coughing, constipation, or diarrhea?
He has abdominal pain and diarrhea, but
Okay.
he doesn't have constipation, no constipation.
Has he been coughing at all?
Wai yana tari ne? All right, the auntie says no cough.
Could I ask you to examine the patient's liver and spleen and see if they're enlarged at all?
Ya kwanta. A kansa ta can. Okay, no problem. Sorry about that. We'll take our time and position. Ka ɗan ja rigarsa sama. Good. Can you see the abdomen?
Yeah.
All right, let me start with the liver. You know, liver is where which side should I start examining for the liver?
For liver, start examining the upper right of the patient from the patient's point of
Okay.
view.
Okay, I should find out from the upper right side. I should look
Yeah.
for the liver on the upper right side of the abdomen.
Yeah. Or from the patient's
All
upper
right.
right.
All right. So I have to start from below, going up. I want
Yeah.
to be examining to see if my hand can actually I can feel the liver enlarged. This is his liver. You can see.
Yes.
The liver
So,
is enlarged. He has hepatomegaly. You can
okay.
see this is the upper. Can you see this is the upper border? This is the lower border of the chest. But you
Okay.
can see this my lower hand, this particular one. So
Okay.
ideally the liver should not be coming down to the level that you can examine it below the costal margin, below this place.
Okay.
But
So the
for me to
liver.
have examined, for me to have examined it, that means he has hepatomegaly, what we call a large liver. The spleen also, to examine the spleen, we have to start from the right iliac fossa. You know the spleen grow and it enlarges from this left side down to this side. So I'll
Yes.
start examining from this side and going across the abdomen, trying to feel if I can get the spleen. Actually, you can see I have reached the left costal margin, the lower border of the ribs. There is no spleen here. He has liver enlargement, but no spleen enlargement.
I believe that he has typhoid fever. Could we compare palms with him?
Okay, you want naga hannunka? All right. Ka buɗe tafin hannunka bari mu gani. I'm trying to compare my palm which is on. Can you see that?
Yeah, it looks like it's a little yellowish, right?
Well, his hand appear to be, well, it appear to be like a bit paler than my own. My own appear to be a bit darker.
Could I have a blood culture?
Culture reveals Salmonella typhi.
So he has typhoid fever, and just to be safe that there isn't anything else as well, could I ask for a full blood count?
Okay, his hemoglobin is 12.6 gram per deciliter.
Okay, so that's good.
The white blood cell count is not elevated and the platelet count is adequate.
So I believe he has typhoid fever. For treatment, we are going to give him some antibiotics. For future prevention, It's smart
Okay.
to have good hygiene and also
Okay.
make sure things are sanitized and that not he's not eating anything that could have been contaminated at all. And yeah,
Okay.
general hygiene is very important.
We are
Okay.
going to make sure that he has been given antibiotics.
I think he'll be okay with oral antibiotic. And
All
also,
right.
if we could also address just some supportive care, maybe like balancing his fluids and electrolyte levels, just to make
All
sure
right.
that's okay.
All right. We will check his electrolytes. His electrolytes, urea and creatinine have been done. Actually, there is nothing that suggests raised electrolyte urea and creatinine. The potassium is normal. The chloride is normal. The sodium is normal. Urea and creatinine are within normal limits.
Okay.
But like you suggested, we can, the fact that he has fever, we can hydrate him to ensure that he doesn't have dehydration. With
Yeah.
high grade fever, they could have dehydration.
Okay.
And, even though he eats, he doesn't eat very well, but the IV fluid, intravenous fluid, will like supplement what he eats.
Okay, that's good.
You want to know about where Usman comes from?
Yeah.
Okay, Usman comes from Abuja Nkwata. Abuja Nkwata is a community in the outskirts of Bauchi. Mainly the people that stay there are low income earners. It is overcrowded with poor hygiene, poor sanitation, and they don't have good and clean drinking water. Mostly their source of water is well water.
Oh, so that must be
Sometimes they have water from their tap, but most of the time they don't have. And when they have, even when they have, is mostly, the pipes that bring the water pass through sewage. And most of them are either rusted and have sometimes at some point they are broken and tied. So a lot of contamination from the water source, especially the tap water.
okay. That must be where the typhoid fever came from then. Boiling water would just get rid of
Okay?
any of the bacteria in there.
That's very good.
Thank
You
you.
really did very well today to examine our patient. You were able to take the history and examine the patient. You investigate the patient and also have given treatment for the patient. Above all, you have also offered advice on prevention of how to prevent this illness so that patient will not have to come back. You talk about the need to take clean water and ensure that foods are clean or cooked very well before eating so that patient don't contact the typhoid fever again. We thank you very much for having your time to come and see Usman all the way from United States of America.
Thank you. I was really happy I
And
can
then,
help. Feel better,
yeah,
Osman.
all right. He said, get better, Usman. So the auntie want to say bye bye. Can you see? She's saying
Yeah.
Mungode. Usman also is saying bye bye.
Bye.